Acrophobia. Acrophobia is an unnatural fear of high places, such as bridges, upper floors, or even stairs. Symptoms include dizziness, rapid heartbeat, and loss of balance. Those affected usually avoid high places like tall windows or mountain views. To overcome it, gradual behavioral therapy is used, where the person is gradually and safely exposed to heights, along with breathing exercises to reduce tension. Arachnophobia. Fear of spiders is one of the most common phobias worldwide. Symptoms include chills, screaming, or sudden escape upon seeing a spider, whether real or in a picture. Those with this phobia avoid gardens, dark corners, and even movies featuring spiders. Treatment includes gradual exposure to spiders in a controlled environment, along with education that most spiders are harmless. Claustrophobia. This is the fear of tight or enclosed spaces, such as elevators, tunnels, or airplanes. Symptoms include shortness of breath, sweating, and feelings of fear or panic. Patients avoid closed transportation, small rooms, and even MRI scans. The most effective treatment is cognitive behavioral therapy, along with anxiety control exercises. Ophidiophobia. This phobia involves a strong fear of snakes, even if they are harmless or only present in pictures. Symptoms include panic, body stiffness, and rapid heartbeat. Patients avoid gardens, wildlife documentaries, or any place where snakes might be present. Overcoming it involves education about snakes and gradual exposure through pictures, then videos, then safe models. Nyctophobia. Fear of the dark is common among children, but may persist into adulthood. Symptoms include difficulty sleeping, frightening imaginations, and constant nighttime anxiety. Patients avoid sleeping in the dark or being in dark places, even if safe. Treatment includes a use of nightlights, along with psychological sessions to understand the roots of the fear. Glossophobia. This type involves fear of speaking in front of others, whether at events or presentations. Symptoms include stuttering, trembling, dry mouth, and forgetting words. Patients often avoid meetings, project presentations, or public speaking. The solution includes regular practice, confidence-building courses, and behavioral therapy. Trypophobia. Trypophobia is an unexplained fear of seeing clustered small holes, like honeycombs, sponges, or seeds. Symptoms include chills, severe physical discomfort, and sometimes nausea. Patients avoid looking at repetitive patterns or similar images. Overcoming it involves reshaping the idea towards these images and avoiding excessive exposure online. Thalassophobia. This is a fear of deep and unknown bodies of water, such as the sea or ocean. Symptoms include intense tension, fear of drowning, and imaginations of creatures in the depths. Patients avoid swimming, boat riding, or even viewing pictures of oceans. Treatment involves swimming in safe environments, benefiting from education about water safety, along with psychological support sessions. Thanatophobia. Thanatophobia is a constant fear of the idea of death or extinction. Symptoms include excessive thinking about death, panic attacks, insomnia, and sometimes depression. Patients avoid talking about death, visiting hospitals or funerals. Treatment involves accepting the idea of death as a natural part of life, along with continuous psychological support to reduce inner fear. Agoraphobia. Agoraphobia is a fear of being in wide or crowded places, such as squares or large markets. Symptoms include feelings of panic, rapid heartbeat, and a strong desire to escape the place. Patients avoid going to open or crowded places and prefer to stay home or in safe, confined areas. This phobia often results from previous panic attacks or feelings of losing control. Overcoming it involves cognitive behavioral therapy, gradual exposure to triggering situations, along with ongoing psychological support. Ailurophobia. This is a fear of cats, which may be due to an incident or superstitions. Symptoms include anxiety upon seeing a cat, confusion, and sometimes screaming and running away. Patients avoid places where cats are present or even cat pictures on the internet. Treatment involves removing negative images of cats and gradual exposure to them in a safe environment. Phobophobia. There are those who fear the feeling of fear itself. This type is known as phobophobia, where the patient fears the possibility of having a phobic episode. Symptoms include anxiety, chronic tension, and expecting the worst continuously. Patients avoid any situation that might trigger stress, even if unnecessary. Treatment involves deep cognitive behavioral therapy aimed at reducing general anxiety and controlling negative thoughts.